I'm Dr. Ralph Ford, Chancellor of Penn State Behrend, and you are listening to Behrend Talks, where we connect with leaders, innovators, and thinkers who are shaping the world. Today we have a very, very special guest, and that is Dr. Ayla Stanford, a pediatric surgeon and founder of the Black Doctors COVID-19 Consortium. And first, I'm going to go through a lot of this, Ayla, but welcome to the show.
Thank you for having me. It's nice to be back.
Well, you're here on a beautiful day in October, and you were a commencement speaker a few years ago. We always love having you on campus. Also, tell our audience you're speaking here on campus tonight too, so a lot going on.
Yes, indeed. Excited to see everybody. Excited to be one of the speakers in your leadership series. So
thank you so much. Well, I'm going to give our audience a little bit about your background. Of course, you came to a lot of national attention actually during the COVID-19 pandemic in an effort to provide testing. We're going to talk all about this and later vaccinations to Philadelphia's most vulnerable residents during the height of the pandemic. You later went on to serve as the regional director of the U.S. Department of Health and Human Services, where you oversaw federal health programs in 5 states. And, you started here at Behrend. You are a faculty member at the University of Pennsylvania. That's relatively new. So another, advance in your career. And recently you just announced that you're running for Congress. So a whole lot to talk about today.
that is true. Boy, it sounds like a whole lot when you say that.
Well, there is, but let's start easy. Let's talk about, you're here with your son today, who's actually visiting campus and thinking about coming here. But you came here many years ago from Philadelphia. Probably didn't know much about Behrend. Tell us what your path was to Penn State Behrend.
First, again, thank you for having me and welcoming me and my son. It's a little surreal as I stepped on campus at 17, and he is 17, and he's here. Wow. That's a little...
History rings, they say, right?
So for me, Penn State was because I knew I wanted to be a doctor from the time I was about 8 years old. And the only person I knew who had gone to Penn State was a cousin of mine. And I said, if that's what it takes to become a doctor, that's exactly what I'm going to do it. When I looked at a map, there were all the Penn State campuses, and Erie was the furthest from Philadelphia. Mm-hmm. So that's the one I picked. And honestly, that's why I picked it, because I was ready to get out of the house. I was ready to be independent, to be on my own, and I didn't want to be super close to my family. I mean, this is a true story. Absolutely. And so I don't think I had ever visited, but when my mom dropped me off, I said, she was crying. I said, see you later. I'm exactly where I want to be. And as they say, the rest is history. It
is, and you did a lot while you were here. We'll get into that, but had you visited campus, or did you just apply and showed up, at the start? Do you remember that?
I don't believe I visited not Behrend or University Park. I think it might have been too expensive. You had to get like a Greyhound or like Trailways bus, Absolutely. Sort of to migrate up through Pennsylvania. And I just... I knew what was in the book, what was in the catalog, and I was ready to come and ready to start my journey to become a physician.
So you said when you were 8 years old, you knew you wanted to be a physician. Was there some experience, or you just, you saw it on TV? What was it that you knew?
Well, it's a couple things. So for one, in Philly, sort of when you're an impoverished kid, everyone goes to the health center. So we went to maybe health center number 5, which I still think is so impersonal, but it's health center number 8, number 9, whatever. And there was a doctor there who was a Black woman. And she seemed so relaxed, and she seemed happy and put together. She had on nice clothes, and I had never seen someone like her before who was a Black woman, except my mom, who was working hard and definitely did not look relaxed like this woman. And so that was part of it. And then the other part was in school, in Philadelphia public school system, when you did well on your exams, it seemed like the teachers paid attention to you more, and you wanted that. And then we had this academically talented AT or mentally gifted student. So if you tested into that, you one day a week got to do something outside of your neighborhood. And for me, it was to go to West Philly on Drexel's campus and spend a day shadowing a college student, which opened so many doors for me. And so it was a combination of seeing someone who looked like me, seemingly happy, being on a different part of Philadelphia where people seem to be better off, and tying in that my mind and my education and my studying was how I could get to that. So I liked science, but I was tired of being poor. And it seemed like to me, if I invested, that maybe I could get to some of these things I was seeing around me, like the doctor at the health center and like the college students at Drexel.
Seeing the role models, super key. But also we find, we invest a lot of effort getting kids to campus when they're young, just so it's not this big intimidating place, so that they can see that there are people like them here and hear from students. And so you got to Erie. It couldn't be further away from Philadelphia. You went from the East Coast to the West Coast. So what was it like when you got here? What sort of environment did you find?
Well, I liked that the campus was big enough, but not so big that I got lost. I found other kids who were also from Philly, so we had our little clique, if you will. I like that in my dorm, and I don't know if you could still do it, you were able to paint a mural on your wall. So I did that. What else? Obviously, the cafeteria.
Cafeteria looked a whole lot different. It was very institutional looking.
Yeah.
I wasn't here, but I saw the remnant 10 years later.
Absolutely. But there were other things, like there was a Miss Penn State Behrend, which I was in. I did not win, but I still have pictures. I was like first or second runner-up.
We don't have that anymore.
Oh, okay. Well, I was part of that. There was a fashion show for Black History Month. I remember that, and there may have been a Black Student Union here. What I really remember, and I'm going to talk about this a bit tonight, were the speakers that came. And two speakers that stood out for me were Julian Bond, who was part of the Southern Christian Leaders Conference with the Reverend Dr. Martin Luther King. And I remember, being a teenager, just excited to hear him speak. And the other person I remember coming to Behrend was Shirley Chisholm, who was one of the first or the only Black, well, that's not true because now Kamala Harris, to run for president. And she was a congressional leader. And so those two speakers came to Behrend. And this is like a 19 number. And so I remember that. I remember applying to be a Lion ambassador, and that was a very prestigious group to be a part of. I love the sweaters. I love the sweaters. And of course, track. And I know I'm like talking, but you asked me about Behrend. But,
Sure.
We
have to talk about track and field.
Yeah, absolutely. And for me in high school, it was that place I could escape to, that I could find friends, and there wasn't a track team here. So I remember learning about how to establish a club, how to have an advisor, what were the surrounding teams we would compete against, and was part of that early development of a track club at Penn State. I remember being educated on which lion we could put on the jersey, which color it could be, and all those steps, and definitely competing in a meet or two. So those are some of my fond memories of Penn State.
Well, I'll tell you, you are credited, and we'll make sure it goes down in the history books, with the person who started the track and field, I think, club, which has now grown into a very significant track and field team here at Behrend that continues to thrive. And the other thing is, I was not aware that Julian Bond or Chisholm spoke here.
Yes.
But that's also interesting to know. By the way, also, Maya Angelou spoke at one of our commencements, and that preceded me as well, too. So we've really had some impactful people over the years.
And I have to say, in a time when it may not have been popular, do you know what I mean?
Yeah.
Like 1988, 1989, and I'm sure in all the archives you can dig this up. But the reason why I know is I remember... This is going to be funny, how I was wearing my hair at the time. And so when I look at those pictures of me with Julian Bond or with Shirley Chisholm, it was right here. Yeah, it was right here.
Right here. And now you're back in that very same speaker series. So think about that. You would have never imagined that.
Oh, It's a lot of full circle moments here.
Yeah.
Yeah, a lot of full circle moments.
You then go from here to University Park. You get your degree at Penn State Med, and you become the first Black female pediatric surgeon in the U.S.
Entirely trained.
I'll let
in
you
the
explain
US.
it. Yeah.
So it's, let me correct. So, first Black woman pediatric surgeon entirely trained in the United States. You never think about that when you're in school. But I think one of my mentors said that to me once and said, yes, there was Dr. Andrea Hayes Dixon who finished in Canada. But when I finished in '06, we were the only two for years, you know? And she's Andrea and I'm Ayla. And so it was always which one is it? It's both our names begin and end in A. But I was very proud of that. To be board certified in both adult general surgery and pediatric surgery is no small feat.
Mm-hmm.
And to be able to have the privilege of someone entrusting their child to you is something I don't take for granted.
Yeah.
So
huge responsibility. Mm-hmm. And so then you start your practice in Philadelphia area?
Yes. So originally, when I finished, I went back to Philly. I worked at Temple University School of Medicine. I was at Abington Hospital, part of Jefferson. I worked at St. Christopher's Hospital for Children and the Children's Hospital Philadelphia. So in Philly, there's like 5 medical schools, so you just go back and forth between them. But somewhere in there, when my children were old enough to talk, they would say to me, my youngest said, Mom, are you going to be here when I wake up in the morning? And that came because I would always leave in the middle of the night to go in and operate and things like that. And after you operated and the child was in the neonatal intensive care unit or the ICU, you had to make sure they were stable. So my kids would wake up and come to my room and I wasn't there. It was with that I left working for the hospital and started my own private practice. And the reason I did it was so I could control my schedule. And so I could say, I'm going to be on call this time to this time. I'm going to start operating at 9 in the morning instead of 6 or 7 in the morning. So I could at least wake up, make breakfast, get my kids ready for school, then go to work, and then come home and be home when they got off the bus. And it's not as lucrative when you do it that way. But what my young child was telling me at 5 was that he missed me and he wanted to see me more. And that's how I went into private practice.
Wow. And I'm sure you learned a lot. There were probably a lot of challenges with starting your own private practice at that time.
Oh, my goodness. Well, the first thing I can tell the entrepreneurs for whatever field, you usually make no money in the first year or two. And you really need to save up because your overhead is so much and you're not bringing in money. So that was the first part. But I was in network with all the insurance companies and all the pediatricians knew me from around the city. So they would refer patients to me. And I was doing fairly well, just learning how to have multiple revenue streams so my family could continue to live the life they were accustomed to living with me getting consistently paid every 2 weeks through the hospital system. But it was the freedom and independence I got back from doing that was worth it completely.
And then it's only a few years later, really, in the arc of history, your personal history, that the COVID-19 pandemic hits in 2020. Now, none of us see that coming. And then your life takes a huge change because you see that there's a problem happening that the rest of the world, maybe even though they see it, they're not doing anything about it.
Right. And so March 2020, I'm sure we all remember where we were, March 10th, March 13th, when everything shut down. Happened to be my twin's birthday, March 10th.
It was Friday the 13th.
Yeah,
I
that's
remember
right.
sitting
You
in
remember.
this room. Yeah, sure.
So, and being from Philly, as you heard, and everyone knowing how to reach me, like I was the doc people could reach. They were calling saying, Ayla, I think I have COVID and I'm going to the hospital. They're sending me home saying I'm not sick enough, or I went somewhere and because I walked up, they were only taking people drive up in cars, or I had a prescription, but my doc wasn't on staff at this hospital, so they wouldn't take me, and all these reasons. And because I had worked at all the hospitals, I called folks and said, are you really turning people away? And they said, the volume's too great, and if they're not in our network, we can't be responsible for taking care of them and getting their results back. We're just too swamped and too overwhelmed. And because I had my own private practice and a surgeon, I had gowns and gloves and masks, and I had an account with LabCorp and Quest so I could get the testing supplies, although I had to fight. When you're a surgeon, they're like, what are you doing with COVID tests? Like, you belong in an OR. And I said, just trust me.
Too precious.
Yeah, I know. Like, it was a hard commodity to get. And so because I had that, and I finally got someone to agree to send me a box, that's how we got started. And in the beginning, I went door to door to door with folks that I just went online and said, if you need a COVID test, email me at my pediatric surgery practice. And folks emailed me, and we figured out how to drive from one part of the city to the other. People would come out on their porch. I would do the COVID test, put it in ice, and then we would go to the next house. We only did 12 tests, and we were out for like 8 hours. I'm like, okay, this is not going to work.
Yeah,
too
not
slow.
Scale.
And then I, started thinking, just with my physician scientist background, well, where is the disease the highest? And I went to the dashboard for the city website, and I could see the zip codes where the positivity rate was the highest, and asked my pastor, could you find me a church in each one of these zip codes? And we basically triaged from where the positivity rate was like 1 in 2, 1 in 4. And those were the churches we reached out to first to say, can we have your parking lot, electricity, and restrooms for the staff? And I literally built a triage hospital in the parking lot, and people went on social media. I reached out to my doctor colleagues and said, you just need to be a licensed nurse or doctor. Like, I can't take any students, anyone in training. And that's how we started. So we went from 12 the first day, 150 the second, and by the third day, it was 400 people.
Wow. And were people skeptical? I mean, were they afraid to come out and even get the tests, or was there resistance to that?
Some were afraid, and that's where I came up with, and a lot of folks say to me, well, why did you call it the Black Doctors COVID-19 Consortium? And I did that because I was trying to connote trust in the name, because at the time, Black folks in Philly were dying at a rate 4 times greater than white. And so I needed to be able to say, because a lot of the mistrust that exists in the healthcare system with Black American folks stems from the non-concordance, or doctors not having a shared living experience. So I thought if I could put that in the name, then people might at least be curious. Black doctors, are there really going to be Black doctors there? Like, what exactly are they doing, kind of thing? And so, yes, they were skeptical, but word spread like wildfire. And ABC News, not regular, your local, but national ABC News had drones over. They could see the lines and the cars wrapped around. And national news took note of what we were doing. And one church was 400. The next church was 300. And it just went on and on. We were doing over 1,000 tests per week.
Picking the church as well. That was a smart move. Yeah.
I mean, when you're focused on a group of people, and during COVID, the folks that were being disproportionately impacted were Black. And so you had to think about, where do they trust? So it wasn't just churches, but we were also mosque, because there's a large Muslim population in Philadelphia. Mm-hmm. We were at union locations. We were at parks and recreation centers. We were on street corners sometimes. We were wherever people trusted was where we went. And I think with any public health strategy, regardless of the group that you're serving, you need to understand what they need and what they trust. And I don't believe, and I've said this before, that people just showed up because I was a Black woman doctor. Like, they didn't know who I was, mm-hmm. right? Mm-hmm. But they knew that church, and they knew the pastor. And because the pastor said, it's okay, that's why. And that gave me an opportunity to earn their trust.
And then you transitioned, because testing need was great. We all remember that. You couldn't get a test to save your life, right? And then after a while you could, but, like you say, it wasn't equitable. But then you switched to vaccination.
Yeah.
So talk about how that changed, because that's where I think you even had a larger impact with vaccination.
Yeah. So I just have to pause and say, this is awesome, by the way. I'm like totally enjoying this. And I know someone sent me a bunch of notes, but this is just really flowing. Okay.
Well, this is by the way, since this is my next job. I'm going to, I'm just
you're-
going to
you're
become a radio interviewer.
Well, Dr. Ford, you are very good at this. This is like, I'm enjoying it.
Well, when it's a fun conversation, so back to it.
So you're right. Vaccinations was a whole different ballgame. By now, I was on the Philadelphia Department of Health board for COVID recovery and response. And I was at the table where decisions were being made. And it was cold and flu season in fall of October 2020. And we knew a vaccine was coming. So, and people were already saying, Black people don't trust it. They're not going to take it. And in my mind, I was thinking, well, I might take it. I don't want COVID. So when people came to get COVID tests from us in October, we started a psychometric tool, fancy word for a survey, when they were coming for their test and their flu shot, to ask their attitudes and perceptions about a COVID vaccine. And it was just maybe 10 questions. If a COVID vaccine were available, would you take it? Why or why not? And we asked a series of questions. We had about 600 respondents in one day, which is research at its highest. And from that, we were able to glean what would make someone feel more comfortable about the COVID vaccine. So December 2020, it comes out. We get vaccinated publicly, we meaning all the staff members at the Black Doctors COVID-19 Consortium, so they see us getting it. I think that made a big difference. But then I went to the health department and I said, listen, we are ready. We're used to taking care of 500 people a day. We're ready. And the health commissioner said, we can't afford to give it to that community first because we can't waste it. And we already know they don't want it. And I said, that's not true.
Yeah.
It depends on who is giving it and where. And I had research to back it up because I had, surveyed at least 600 people. And I kept getting no. So subsequently, the health department gave the contract to do the mass vaccines to a young group of students at Drexel who came up with an innovative idea to mass vaccinate the city of Philadelphia. But they were doing it at the convention center, which I knew most people in the community were not going to go to the convention center. It's like hard to navigate. There's nowhere to park. You can get lost in there and all of that. And it came out and they started, but the rooms were empty. They weren't full. And a lot of people were not going there. Then it came out that they were vaccinating elected officials in their homes, that they were taking the vaccine home, that the records were shoddy and all of this. And then it became a front page story in the Washington Post, front page story in the New York Times about how the health department had invested in this group and they failed miserably. So they had to shut them down. And then they came to us and said, can you lead the mass vaccination? And I say that to say that sometimes there is still bias in health and that we were not the first choice. We were the second choice when the choice that they chose the first time didn't work out. But with that, we, and Bloomberg News reported, we vaccinated more Black residents than any other city, major city in the United States, because we were intentional, because we went to the people, we asked them what they needed, and we earned their trust with the testing first, that the vaccines just came naturally. And so you're right, it was not a small thing.
I remember watching some of the videos with people who were hesitant and how you had to meet with them to overcome the vaccine hesitancy.
Yeah, absolutely. Some folks came day after day. No, not today, doc, but it's a good thing what you're doing here, but not me, not me. And then some of the parents were interesting, like they may not get vaccinated, but they allowed their children to get vaccinated because the kids wanted to play in sports, because they wanted to go to the prom, they wanted to get a summer job. and it was requiring them to be vaccinated and show that card. Remember the card? And so they didn't do it.
You had to show it to get into some places.
You had to show it to get in. And so, it's interesting as we go down memory lane on this, but we really did earn the trust of the people, and with that, saved lives.
Yeah, absolutely. And for this, I will go to a recognition. You get named a CNN top 10 hero, and by that time you were well known here at Behrend, and I think we were all rooting and voting for you. You were in the top 10. You didn't make top 1, which that's
right.
Really, but I also think, didn't Dr. Tony Fauci introduce you there? So tell us about this experience.
It was crazy, first of all. When Anderson Cooper is telling you good job and Kelly Ripa, it's like, what? Is this my life right now? And there's like all this makeup and bright lights and you're going to commercial break and everything. It was surreal. And it really highlighted the work we had done and just led to more and more opportunities for me and for a community that typically you would not hear about or from.
Yeah, because then you transition to something called the Dr. Ayla Stanford Center for Health Equity.
Health Equity. So, or ASHE as we fondly call it, folks started coming even after they had gotten their vaccine, and this time they wanted us to look at their medication list, or they wanted us to look at a lump on their neck. And they said, well, you're doctors, right? Can you help me figure this out? And I realized that the community had come to rely on us. And I was already like, okay, I've done my part in history. I'm going back to the OR. But they had really come to rely on us. And interesting from a business perspective, which I did not know this would happen, because I had my own practice, I was able to run that entire operation with my own infrastructure. And so all the people for testing that had previously been turned away because their doc wasn't on staff, because they didn't have insurance or whatever, I was able to submit claims for that work. And I turned a profit of over $1 million by doing that. And I took that money and reinvested it and built the Dr. Ayla Stanford Center for Health Equity. So that's how we built that 10,000 square foot with 8 exam rooms and with pediatrics through geriatrics and everything in between, and also psychiatry and behavioral health. We're about to open an imaging center with CT scan and ultrasound and mammography and all of that. But I took the money that I wasn't expecting to make. I mean, honestly, I was living a comfortable life as a surgeon. So this was bonus. And I took that and reinvested it in that community. And we're now going on 5 years. Wow. We have our second location. We've taken care of thousands of people. We are a school-based health center for the school district of Philadelphia, which means that kids can come during the day at any time to get any care that they need. And it's one of those examples of triumph over tragedy that came from COVID. And so I'm very proud of that.
Well, that impact will last a long time. Another example of you being an entrepreneur as well, taking the initiative and taking the risk that you didn't have to do. And what if people want to donate?
Oh, so bdccares.com. So it's Black Doctors Consortium cares. It's because doctors cares. There's so many things, but the website is bdccares.com. And then there's something on there about support.
And even if people didn't get that, easy enough to find
with
a Google search. But it is important for people to know that they can donate to that good cause and continue the work that you're doing. Then you go on to you get nominated by President Biden for an important post.
It is. It's been a busy 5 years. So when we were doing that work, one day people were lined up around the building, and young people keep doing what you're doing, but a young person videoed it. And I posted it on X. It was still Twitter then, but I posted it and I said, just as a caption, White House COVID response team, where are you? That's what I wrote. And I got a call from the White House that night. I was like, oh my gosh, right? And they asked,
a Twitter post.
Dude, so be careful what you post, okay? But it was a good thing. And they said, what do you need? You know, we see the great work you're doing. And I said, my people are burnt out. We need more support. We need more resources. There are communities we just can't get to. My folks are getting sick. And with that, they connected me with the city health department, and we were able to lead a FEMA mission. And with that came personnel, and we went to the public schools of Philadelphia, and we were able to go in and vaccinate the children, because by now the kids were starting to get COVID, and we did have deaths from COVID in Philadelphia for folks under the age of 18. And by doing that, we doubled the vaccination rates in a lot of the schools and saved more children. And so, you know, you never know when what you're doing, you're actually being interviewed for a job. So after I led the FEMA mission, I got called from a high-ranking elected to ask, was I okay with them nominating me? And then I was appointed the U.S. Department of Health and Human Services Regional Director for, as you mentioned, Virginia, West Virginia, Delaware, Pennsylvania, D.C., and Maryland.
Biggest thing you learned there? What was the biggest thing you learned in that position?
I would say the processes to get things done in a bureaucracy, and how to be effective, you really have to work with sometimes people you don't like and find the common thread and goal so that you both achieve the desired mission or opportunity. The other thing I would say I learned is how intertwined local, state, and federal government is, but people don't often see that. They see the mayor, they see their city council, and they don't see how their congressperson or their senator is really advocating on their behalf. But they are. So in order for the governor to have money, that comes from the federal government. In order for the city to have money, that money comes from the governor. And it all starts in D.C. And just being able to connect the dots and realize sometimes when I was frustrated, I might have been frustrated at the wrong person, and recognizing that it's all a continuum.
You know, I preach here in Penn State, patience and persistence will win the day, and just takes time. But if you have those, if you do that, you can be successful. Well, I want to make sure we hit two more items before we finish, and one is that along the way you won another award, and I was there when you got it in New York City, which is the Pennsylvania Society, which is, and you won something called the Gold Medal Award that's given out at their annual event, a great event in New York City, and that was a first as well. And I'll let you tell the story, but I will say I've been going for well over a decade. By far the best acceptance speech I've ever seen there. And I say that everyone else in the room thought the same thing too.
Thank you. Wow. That was a special night. That was a special night to really be recognized by my peers, people who I didn't know who knew me from across the entire Commonwealth. So urban, suburban, rural, honestly, Republican, Democrat, independent, everyone that basically recognized that in a time of need, I had stepped up and led a movement, if you will. And it meant a lot, and to share that with my children and my husband, and to know that I was the first Black woman to receive that in over 112 years, to be alongside astronauts and civic leaders was very special for me. And how I got reacquainted with my Erie family and my Behrend family, which I appreciate so much. And most of what I said that night was not written because the speech was supposed to be 10 minutes. I think I was like 17 minutes in. But I just felt so moved, and everything was still raw. Everything was still raw then. But I enjoy it, and I'm a lifelong member, and I'm sure I'll see you in New York in
I
December.
will see you there this year. Yeah.
So, yeah.
You're a convert to the PA Society, and it really is a neat place for the leaders of Pennsylvania, and there's a history behind that, and people scratch their head why. But yeah, a lot of leaders from PA show up in New York City.
Why not leave PA? We're here all the time.
That's right.
In New York.
We have a little fun,
holidays.
and it's a great time.
We have a great time.
Well, I'll tell a few weeks ago, you sent me a text, and you said, Ralph, I think I'm going to run for Congress. And, or you called me, actually.
True story.
True story. And I think I was a little bit like, wow. And you since have announced, but I within a day I recovered and called you back and told you, I think you'd be perfect for that.
You did.
Because
I think you were stunned.
It's politics are so difficult. That's the reason why, you really want to step into that arena. But congratulations, you have, and I think you're in a primary race, I believe. But do you want to talk about that and what's moved you to do that? And truly, public service is noble, of course, and we're happy to have you talk about that.
So, my default is to serve. That has been my entire life. And gosh, the more I have given, the more I get back. People know me locally and nationally from service. Do you know what I mean?
Mm-hmm.
Not from bright lights and the special title. Any title I have has come from the people. And now that I have this platform, and when I talk, people listen, and I can advocate, to me, it seems like this is just the next path at a higher level to have the most impact for my community. And so for it to be in Philadelphia, which is the district where I was born, where I still work, is that much more special. And it's a competitive seat. The incumbent,
at least 5 people running.
Oh my gosh, it might be up to 8 now.
Okay.
But I would say, not my summation, but what the news has mentioned, that the main 4 people are myself, State Senator Sharif Street, and 2 House Reps, Chris Robb and Morgan Cephas. But I'm proud to say that the incumbent, who said he's retiring and not running, endorsed me.
Wow, congratulations.
He endorsed me for the seat and said that I've demonstrated leadership in the most trying and challenging times, and that's what we need now, not more of the same. And so I'm excited. It's been exactly 8 days, and my life is forever different.
Is that because what? News media is calling? And
Lots of that. Lots of folks want to talk about support or where I stand. And I've got a lot of work to do. The primary is May 19th. I've got 37 wards I've got to meet with in different communities that knew me from COVID, but need to see not just what I think about health, but about economic stability and viability in communities, about feeling safer where you live and work, about putting resources into education in our public school system, and of course health, which everyone is talking about.
Sure.
Hopefully by the time this airs, the shutdown will be over. But for them to really hear how I will advocate and push for what we need in Philadelphia, PA District 3.
Well, congratulations and good luck to you.
Thank you.
All right. I'll give you the last word, but what would your message be? What's your message going to be to our students this evening?
Oh, my goodness. The message to the students, and maybe even what I may have said to myself when I was in college, is everyone doesn't see your vision. Everyone may not see what you're trying to achieve, but you be true and honest with yourself about where your strengths are, where your challenges may lay, and work hard to overcome the things that you're not great at, but not to have your dreams be deferred. And maybe if they're deferred, don't allow them to be denied. If you choose not to go after it, let it be because that's what you wanted, not because someone discouraged you. And I don't have much fear these days except of God, and my faith is strong. And surround yourself with people who are about uplifting you, honest with you, but about uplifting you to be your best self, to find joy in every day, and know that you are uniquely made, and there's no one else like you, and there will never be. And so make the most of the life you've been given.
Outstanding advice and wisdom. Thank you so much for being here.
Thank you for having me. This was fun.
You've been listening to Behrend Talks. I'm Chancellor Ralph Ford. My guest today is the extraordinary Dr. Ayla Stanford, a Behrend grad, done so many wonderful things. Thank you for being here today.
Thank you for having me.